Welcome, everybody. Welcome to this internal webinar that's going to be presented by the Red Crescent Climate Center and Concern Worldwide. I'm really excited to welcome you to this, what's really a learning webinar, where we're going to be sharing a lot of the learning that's happened in this collaboration between the Climate Center and Concern Worldwide, and particularly the Concern ERNE program. So the title of it is Implementing Early Warning, Early Action, with a particular focus on fragile contexts. And we'll see that the issue of fragile context comes through through the whole discussion, and a lot of the learning is around that. So this is us. This is a screenshot, a group photo, if you like, that we took just before we started. So you can see what our faces look like. So thanks. Next slide, please. So what we will be covering in the webinar, the real focus is on the lessons learned by the Concern ERNE teams in Sudan, South Sudan, Niger, and Ethiopia. So specifically, we're going to be focusing on the risks and the responses to those risks and the actions that have been implemented. We'll be looking at the risk matrix that was developed across the different countries, and the early warning system indicators that are embedded in that risk matrix, how those are monitored through time, and how they trigger different actions, how the different indicators are being prioritized across the different countries. We're really recognizing in this learning that each country is different, has a different context and different priorities. And then diving into a lot of the operational challenges. So a key theme through the webinar is how do we implement early action or anticipatory action or forecast-based finance. We'll unpack these terms in a minute. How do we implement these kind of activities or programs in these really challenging contexts? So the operational challenges around that. Very related to that is the beneficiary selection. So how beneficiaries targeted are identified. And then key to learning is how do we monitor the impact or effectiveness of these early warning systems and the outcomes of early action, early warning, and anticipatory action in these different contexts. So this is what we're going to be covering, and then added onto that. Next slide, please. Some perspectives from the Red Cross Climate Center's side. So as the Climate Center, we've been involved in helping and supporting the implementation of forecast-based financing and other anticipatory actions across a number of countries across the world with different kinds of partners. So we want to bring in some of that kind of learning and experience, and also learn from the ERNE experiences. So we look at how these interact and how we can learn from each other. Thanks. Next slide. And finally, because we're going to be talking about a lot of really difficult challenges and barriers, if you like, and the complexity of these contexts, we're going to end with some inspiring thoughts and some looking forward to where things can go in the future. Thanks. So who will be speaking? So just introducing myself, I'm Christopher Jack. I'm a climate scientist. I'm a science advisor for the Red Crescent Climate Center. And I'm now going to introduce the speakers who will be presenting today. And as I introduce them, if they could just unmute and quickly turn the cameras on and introduce themselves. So let's start with Alamayehu. Could you introduce yourself?
This is Alamaye Labata. I am Cash Market Early Warning Election Advisor based in Ethiopia country. Thanks.
Great, thanks, Alamaye. Next up is Ibrahim.
Good morning. I'm a manager here, Concern Worldwide Niger.
Great, thank you.
Bye,
next up, super, thank you. Next up is Haman.
Okay, thank you.
Yes. We're breaking up a little bit. Okay, we'll come back to Haman. Haman is the ERNE program manager in Sudan. Also in Sudan is Tommy. Tommy, I wonder if you could introduce yourself.
Yeah, hi. This is Tommy Chimpanzee. I'm the former deputy manager for early warning, early action in Sudan. I'm actually speaking from I'm speaking from Malawi. Over.
Right. Thank you, Tommy. That represents the flexibility of complicated contexts. So thank you so much for joining, even when it's difficult. Next up, we have Isatu. Hi, Isatu.
Yes, good morning, everyone. I'm called Asatu Lilo, working as ERNE Program Manager for South Sudan. Thank you.
Great, thank you so much. And then from Concern Headquarters, we have Jacqueline. Hi, Jacqueline.
Good morning, everyone. So I'm Jacqueline Fries, and I'm working at our Dublin office as the Concern Early Warning, Early Action Advisor.
Great, thanks. And last but not least, my colleague from Red Crescent Climate Center, Simpiwe.
Hi, everyone. My name is Simpiwe Laura Stewart. I'm a technical advisor on climate and conflict settings at the Red Cross Climate Center.
Great, thanks so much. So that's who will be speaking. We have a wide range of expertise across a number of countries, which I think is really exciting. So I'm looking forward to the discussion. Can we go to the next slide? So just as a quick introduction to broaden up the context for those who are not familiar with it, introduce some of the ideas. These are just some of the slides that were included in the training that we implemented across the program. The background really is that we're trying to shift through anticipatory action. We're trying to shift the way that disasters are managed. And I know everybody in this room and many people watching will be very familiar with this. But just to reiterate, we're trying to shift from a response, even if it's a rapid response, where disaster occurs, the call for assistance emerges, and then there's a response involving different measures, but often cash distributions that occur. What we're trying to do, and what is the big push across the world, is more towards anticipatory action, where through forecasting, we can actually anticipate a disaster occurring. We can implement early responses, early cash disbursements, and other types of responses, and that can reduce the impact. So the key thing there is you can see the dollar signs on the little man running on the right is actually reduced. The impact is reduced if we can implement early action or anticipatory action. I wanted to sort of work through these different terms a little bit. You may have heard of early warning, early action, forecast-based financing, anticipatory action. We're not going to argue too much about the different terms. There are different nuances and different understandings of these terms, but fundamentally, we're looking at the same sort of concept. So the next slide, please. And FBF in particular, which I think is a really important component of anticipatory action, is where finance is released based on a forecast. And I want to really emphasize here that while there's a lot of challenges associated with this is often what we're trying to aspire to, is that we actually trigger early actions and the release of funding based on a forecast before the event has even occurred, before we even can see the impacts of an event, for example, a drought or flood. Purely based on the forecast, we can trigger early actions. And it's quite challenging. And obviously, there's always a risk of triggering and then the event doesn't occur. But these are the kind of things we've wrestled with as we've had this collaboration. Thank you. Next slide. So the Climate Center Concern collaboration, and I really want to emphasize it as a collaboration. And I think and I hope it has been very collaborative. And we've really wrestled together in the training and in other engagements about how we bring these ideas into play in these particularly difficult contexts. So it's bringing together climate science and this FBF and anticipatory action expertise with the Concern ERNE program and the in-country implementation. So really much bringing it to ground. So kind of key highlights, there was initial scoping studies for Niger, Ethiopia, DRC, South Sudan, and Sudan, that really provide an assessment of the landscape and the opportunities and potential challenges and recommendations for implementing. In year two, a lot of the focus was on an in-depth Niger case study to understand the particular context in Niger, the challenges and opportunities and priorities. And that has been written up in this in-depth study that is available. And in the slide just now, Jackie will share a link to the Knowledge Hub where you'll be able to access that. We do have constraints in participation from Niger today. So for those looking for more details about the implementation in Niger, I'd encourage you to explore that resource. We also looked at the risk matrices for Sudan, South Sudan, and Ethiopia. So there was an assessment of those risk matrices and some input on those. And then year 3 that we're ending up now, we focused a lot on training and collaborative learning. And I really want to again emphasize this was collaborative learning. We were learning from each other, looking at the climate science, the triggers, the targeting, monitoring, budgeting, and funding mechanisms. So that was the main focus of year 3. And then we're moving on now to this webinar. So at this point, I'll hand over to Jacqueline to introduce the ERNE program itself. Thanks, Jacqueline.
Thank you, Chris, for that run through of what we've done over the last few years. So the early warning, early action component of Concern's ERNE program has 2 main objectives, as you can see on the slide. One is still primarily life-saving activities in response to disasters, because we've chosen to work in locations in these countries that are very disaster prone, either climate disasters or even displacement due to conflict disasters. So that's the primary objective, but we have a secondary objective, which is the preparedness focus. These are activities that help build community resilience to malnutrition and build local capacity to better respond to disasters. So within that, we have a risk-informed early warning system. We're very conscious of the context that we're working in, and as Chris has said, we've been drawing up risk matrices to reflect that. But this activity is embedded in a much wider program. The ERNE program, Enhanced Response to Nutrition Emergencies, which is a 3-year program, actually has a primary objective, to reduce malnutrition with funding from ECHO. So the countries are highlighted here on the map. Our representatives have already introduced themselves, who've been implementing the activities. So these are extremely fragile humanitarian contexts. And our staff will be sharing experiences on the setting up early warning systems from scratch, or helping strengthen existing ones so they actually reach rural communities so that they can bring information into national systems. We've piloted ways of increasing the local relevance of these systems. Over the past 2.5 years, we've responded to 20 alerts in these countries, and our response has been, as the forecast-based financing and anticipatory action plan is, to respond with one activity, which was giving cash transfers or food in kind when the markets weren't able to provide the foods themselves. So out of our 20 responses over the years, I'd say only 1/3 can be considered early actions, where we actually protected households from the impact of oncoming droughts, dry spells, or flooding, or displacement. The rest were still probably traditional emergency responses because of the ever-changing nature of the context that we're working in. But we'll hear more about that from the team. Thank you.
Thanks so much, Jacqueline. It's really impressive when you see the numbers and really encouraging. So even though there's a lot of challenges, it's great to see the real impact that's been made. Okay, so at this point, we're going to start going through a number of questions, and the country experts are going to provide some input. And I really want to acknowledge the expertise that is in the countries. I've really come to respect and admire the people working in each country and their understanding, their ability to overcome challenges. I'm excited to hear their inputs here. So one of the key starting points of implementing early action in a particular context is identifying the risks at the country level and using that to design the project and design and plan for different implementations and responses to those risks. So I'm going to start off by asking what specific risks were identified at the country level, going through each country, and which ones have been responded to during the implementation, a little detail of how those responses have occurred. So moving on to Alamayehu, based in Ethiopia. I wonder if you could provide some input.
Thank you. So based on an integrated risk analysis in Ethiopia, we have identified the following risks, namely conflict, droughts, flood, animal and human disease, hailstorms, and excessive rainfall. And of these risks, hailstorm and excessive rainfall have been identified in highland areas of the country. So in Somali region, On top of the risks that I've already mentioned, we have identified desert locusts. So regardless of having all these risks, we managed to respond to flooding, conflict, and drought. So so far, we are able to respond to 2 early actions for droughts and the 5 rapid responses and 1 scale up of early action. Thanks.
Thanks so much, Alamir. Moving on to Isatu in South Sudan.
Thank you very much. In South Sudan, we have identified a number of interrelated and complicated risks within the state where we have been operating. Among the major ones are flood, drought are the major ones. And every time there has been change in the risks. So conflict is another one, and the fourth biggest one is the economic crisis that the country has been facing. These are the 4 major risks that we have identified, and based on that, the program managed to respond in 1 location as early warning, as early action, and the remaining 3 responses were considered as rapid response on multi-purpose cash transfer. Thank you.
Great, thanks so much. And unfortunately, we don't have someone from Niger to respond at this point, but again, encouraging you to go back to look at the learning paper, the Niger learning paper, that has a lot of details there. Thanks so much. So, in identifying the risks, the ERNE program has implemented an early warning system risk matrix, which identifies the indicators, thresholds, alerts, and alarm triggers for each country. So what you see up on screen here is a generic risk matrix, and these were customized and developed further for each particular country. What you see on the left-hand column is the different indicator categories. So we have these 6 different categories of climate, livelihoods, markets, population movements, health and nutrition, and coping capacities. And under each category, there's a number, sometimes more than 1 indicator that would be monitored to monitor that particular risk. So for example, precipitation is an obvious one. We've already heard about droughts, we've heard about flooding, so looking at river levels as an indicator of flooding, and various other indicators. We'll come in a minute to how those indicators are monitored. The next 3 columns are really looking at how those indicators turn into action. So we have what is a normal value for that indicator, so where we wouldn't be worried about the value or what's going to happen. That shifts into an alert level. So if you've got below average rainfall, we've got a certain shift in food prices. This would become an alert level, and you may begin to start acting or being prepared to act. And then an alarm level, where you definitely know that a disaster is unfolding, and you're acting, you're triggering action. So obviously, identifying these indicators is really key, and then identifying these different thresholds or triggers is really, really important, and often really challenging given the complexity of the context and the dynamic way these contexts are changing through time. So it'd be really interesting to hear, again, from each of the countries, how the indicators were put together, and particularly how are they prioritized, so which indicators were prioritized across each country. So we'll keep this up on the screen so you can keep a reference to it. But maybe if Tommy is able to connect, if we could start with Tommy in Sudan to speak through the process in Sudan.
Yeah, thanks a lot. Okay, maybe let me start by tackling at the first question, which for Sudan, we are not able to give our answer. As the identified list in Sudan, after we did the contextual analysis, we came up with a few lists. The first one was the tribal conflict. Yeah, that has also been highlighted in the other countries. The other one was the climatic, the shocks, especially the flooding. The third one was also related to the deteriorating economic situation, which was being influenced by the inflation. So these were the key list that we actually identified. Yeah, so coming to this question on the indicators and the threshold that we had here to prioritize. The first thing that we had to do was to understand and analyze how each indicator is contributing to the project outcomes. Like looking at the ERNE being a basically it's a nutrition program. We also observed that these three lists, they were having a negative impact in as far as attaining the positive nutrition outcomes is concerned. Looking at the economic challenges on the inflation, we were like doing the market assessment so that they should be able to inform us on how those indicators are faring, so that those should be the basis. If we say we want to activate the response to do the ERNE action, we should be based on the information that we are getting from the market, and which is also having a negative impact in the overall objectives of the project. The population movement was also key, because looking at the context of Sudan, we normally encounter the tribal conflicts, which actually influence to the movements of people from one place to the other now and again. Yeah, so that one, in coordination with the relevant stakeholders like the Humanitarian Aid Commission, we were able to be monitoring the movements of people, and that was also informing on whether we should be able to activate our early warning area action. I'm sure Haman will also be able to add over to you.
Great. Thanks so much, Tommy. That was really comprehensive. Right. So moving on, I wonder if we could, sorry, just reflecting quickly on Tommy, I think the population movement one is a really interesting one, and it certainly come up in the questions around targeting when you have large population movements. So I know that was really interesting to me to try and understand how that is managed as a very dynamic context. Alamayehu, I wonder if you could provide some insights from Ethiopia.
Thank you. So the risk matrix have been objectively monitored in our case. So we have standard indicators, and for climate, livelihood, market, and life. So for market, we're collecting market price for staple foods, like staple foods as well as the livestock. So what we're doing was, like we're comparing the price of this staple food with the same months last year. So we do have a kind of triggering points for each indicator. So the first triggering point was like an alert. So when it is an alert, we usually activate an early action, like for instance, for the onset of the rain and the price increase beyond the normal, by comparing the same months with last year. So the second triggering point that we have been using for rapid responses, like an alarm. So on top of this, we do have a follow-up indicators, which is validated by DRR committee and being translated to the respective local language, so that the DRR committees have clearly understand the thresholds and alerts and like. So we are doing this monitoring of risks just by using these thresholds, and which has its own triggering points. Thanks.
Great, thank you so much. I'll hand over to Isatu in South Sudan.
Okay, thank you. We had at the very beginning, we tried to contextualize this template and the contents of the template because it has a number of indicator category and indicator description. So given our contextual situation, we just narrowed it down to certain indicators. For example, with the climatological thing, we don't have those sophisticated gadgets to measure the rainfall performance. So we had to do in a very traditional way. And the market system monitoring and the functionality of market monitoring itself has significant, and this is the most responsive indicator that we have selected among the many. So in our context, as compared to some other countries, even in places in different countries, the indicator which could be identified as alarm or alert could be normal in our context, given the chronic socioeconomic aspect of the country. So we did that market as one of the indicators. And the population movement is really very common in our location because of natural and man-made disasters. So we just wanted to make that the measurement to be in number instead of percentage. So we set that number, and it required a collaboration and a discussion with the several humanitarian actors, government counterparts, and the community leaders. The other one was health and nutrition, especially in the case of health. We just picked one special kind of indicator, the occurrence of cholera and related watery diarrhea. So this is one aspect. And nutrition-wise, the number of children and malnourished mothers admitted to the health and the nutrition facility were chosen as one of the indicators. So we just narrowed it down to 3 to 4, specifically measuring the health, nutrition, market, and the climate situation. Thank you.
Great, thanks so much. And it's really interesting, again, the focus on population movements. And you've also referenced another important aspect, which is doing this in collaboration and coordination with other actors in the landscape, because we want these responses and to be coordinated, and everybody kind of agreeing on when responses will happen. So thanks for raising that particular point. Excellent. So just moving on from this, as we've got these indicators and the different thresholds identified, obviously the next key step in that is monitoring the early warning system. So monitoring the indicators, and that requires accessing them, processing the data, having access to that data that isn't always reliable, may not always be available. So I wonder if we could just get a couple of reflections on how these indicators are monitored, so how the early warning systems are monitored. And I'm going to ask Alamayehu to speak from his experience in Ethiopia.
Thank you. So we have a well-established and national-driven early warning system, and the data is being collected on a monthly basis. And regardless of having this strict system in place, we have identified that we are not gathering all the data that we require and be able to provide a response or a specific response for it. So because of these things, I would say one of the biggest challenges, challenge to date has been finding the actual or reliable data source is one to mention. So, and some of the official sources for early warning data includes in our cases, like for instance, from Warada early warning and disaster preparedness, we usually get kind of advice and warning about different disasters in a given area. And the other sources formal sources for this early warning system is Warada Health Office. We usually or regularly access nutritional status of people in most seriously affected areas, and the outbreaks information is usually collected from this Warada Health Office. So again, from trade office, usually collect market data and the price of this livestock and staple crops is from trade office. So again, from livestock office, we usually collect livestock body condition, availability of pasture, access, and like. So we also get from UN agencies and Food for another NGO like Food for Hunger, like number of beneficiaries, and also the amount and the type of emergency assistance which is required. And WFP usually provide us with a monthly market watch or market data of these staple crops as well as livestock. So on top of these sources, we usually get climatological data from meteorological stations. So from the community-based sources, we usually collect information like through making informal communications with Kabale-based early warning committees and Borada office. And we most recently we have been using a tool called Roundtable Monitoring for Early Warning System Activation and Analysis. So these are the official sources of information in Ethiopia that we are using for monitoring early warning information. Thanks.
Thanks so much, Alame. So you've highlighted so many important points there about the difficulties of accessing information from different sources, from filling those information gaps, when coordinating the access to that information. So that's really helpful, and highlighting a lot of the challenges associated with that. So I'm going to move on to the next question, which really dives into this fragile context. So Concern is working within these particularly fragile contexts. It's characterized by conflict. We've spoken a lot around population movements already, and these are all rapidly changing circumstances that are difficult to predict. So yeah, I wonder if we could stop the slide share for now. It'd be nice to see people's faces as we dive into this. So the next discussion is going to really be around what are the challenges associated with working in these contexts, and particularly in implementing anticipatory action, which we know is quite a sort of rigorous structure. It requires data, it requires these thresholds and triggers to be pre-decided, and yet the context keeps shifting and changing, along with other issues around access and various other challenges. So I wonder if we could hear again from the country representatives. I'm going to start with Tommy to give some examples from Sudan on what these challenges look like. Thanks, Tommy.
Okay, thanks. But yeah, allow me also to add on the previous question, because I think it will not be fair for Sudan to also give maybe an overview on how we address maybe our early warning action in that aspect. I should say that Sudan, it is a bit unique than the other countries, because like the early warning system, we are starting from the scratch. Like the local stakeholders, they had there was no coordination, like structures, even maybe the capacities of the stakeholders was not that up to standard. So like in Sudan context, we had maybe to start from the scratch. Like maybe developing the capacity building of the relevant stakeholders, and setting up the early warning early action committee, which developed the TORs. Then it's when we had to come up with the list matrix. Then we had to assign each and every stakeholder as to what information is it required for them to come with, so that we input on the list matrix. I just wanted to give that picture. Coming to this question on the challenges in Sudan context, one of the challenges that we faced was insecurity. So when there are tribal conflicts, maybe it was taking more days for us to be created, to go on the ground to do the assessment. So that was also affecting the timelines of response. So that was the major challenge.
Great, thanks, Tommy. Those are really useful examples and really highlighting the challenges of doing early response and rapid action when there's so many different institutional challenges and access to information and coordination. So thank you. Those are really good examples. Alamayehu, I wonder if you could provide some insights from your work in Ethiopia.
Yeah, thank you. So the major challenges, I would say, the identification of these triggers is like it's very, very technical, because by principle we are supposed to monitor it on periodic basis. So the capacity of these government sectors that I have mentioned for formal sources of information have limited capacity on identification, as well as following up of these thresholds that I've mentioned, like to say whether it's threshold, the threshold is it's an alert stage or alarming stage. So this is one of the challenges. And the other challenge is like the occurrence of floods, which is not the kind of early action, has induced the kind of displacement that's triggered the kind of rapid response at the expense of early action. So, and it has switched our focus to rapid response instead of early action. So the other thing is this forecast-based financing is not developed or designed with the full participation or engagement of the stakeholders as well as the community. So to accept the results of this forecast-based financing is going to be a challenge for us. So and there's other major challenges I would say is accessing this the target communities is very, very challenging, because the area where they are located is hard to reach area. So I would say these are some of the challenges we have experienced. Thanks. Over.
Great, thanks, Alma. So you've highlighted some different points there. I'm particularly interested in your comments on the complexity of the risk matrix, the complexity of accessing and interpreting the different indicators and the thresholds, identifying those. I think that's something that we're learning as Climate Center as well, that often the very technical data focus raises a lot of challenges. Also, the access question is really important. So you may have the best system set up, as you could imagine, but if you can't actually access the community at the end of the day, then everything kind of fails. So thank you. Those are really, really helpful. And just speaking of this kind of broader learning, at this point, I'm going to ask Simpiwe, my colleague from the Climate Center, to jump in. And as you've been listening to this conversation, you'll realize that the experiences that Concern and ERNE program have been experiencing are certainly not unique. And I know we're engaging with that across a number of different organizations. So I wonder if you could just provide a few comments about the commonality of these kind of experiences of implementing anticipatory action in conflict and fragile contexts. Thanks, Simpiwe.
Thanks, Chris. Can you hear me?
Yes, that's great. We're good.
Perfect. Yeah, so I think, you know, as the colleagues in country have pointed, as the colleagues in country action in general, in the best of contexts, but certainly in fragile and conflict contexts, there are additional challenges. I can speak here from the experience of the Climate Center in terms of the climate and conflict team and our anticipatory action, forecast-based financing teams, but also in terms of broader humanitarian and development agencies. So some of our partners at organizations like the World Bank, and the United Nations family in terms of implementing anticipatory action in fragile contexts. So I think one really helpful case study that lends transferable sort of anecdotes is the context of climate, conflict, and displacement. So one of the most marked impacts of fragility, which is climate and conflict together, tends to be related to the number of displaced people. At the Climate Center, we've done a lot of work on anticipatory action in detention and refugee camps, which would be particular to fragile conflict and climate affected contexts. So you can think of Bangladesh and Syria. And this is work through the Anticipatory Action and Conflict Working Group. So we identified designing anticipatory action in refugee and internally displaced persons camps specifically. And I think some of those that are worth highlighting and that can maybe be considered in the context of concern are those related to issues around freedom of movement. So, you know, refugees and in some cases, IDPs face legal restrictions on their right to freedom of movement, and that can curtail or increase, exacerbate challenges related to anticipatory action. characteristics of camp populations. So in the same way as some of the targeting that Concern might be doing might be related to certain types of households, we can imagine in climate and conflict context, the characteristic of populations creates challenges in conducting anticipatory action. So whether we're working with women and children, with female single-headed households, understanding the characteristics of camp populations in particular is really imperative to deciding how displaced people can best be helped. There's also issues related to short-term infrastructure and long-term displacement. And you can think of short-term infrastructure even in terms of systems related to distributing social protection, distributing support, climate smart logistics related to purely access related concerns. So has infrastructure damage, has public service access increased the burden or increased the risks associated with delivering support, making use of existing humanitarian responses and coordination systems. Obviously, both climate and conflict create marked challenges for coordination and for collaboration between humanitarian agencies in these contexts. And certainly Concern would have that experience in conflict and climate affected contexts. Engagement with national and local disaster management actors. So are we able to access climate related information? Are we able to operationalize and implement it when it is time to conduct social protection related support? And then obviously trauma-informed anticipatory action, and that's a space that's gaining more traction. So how is trauma as a concept included in anticipatory action? And these are sort of issues related to psychosocial aspects, and we can think of gender and social issues under that trauma-informed anticipatory action as well. So those are some of the challenges and sort of throughways for opportunities to better operationalize social protection in anticipatory action. Thanks, Chris.
Super. Thanks, Imperial. You've covered a lot of ground there, and I'm sure a lot of people will be interested in different aspects of that. So I'm sure there'll be opportunities to follow up afterwards. But it's very clear that these challenges of implementing anticipatory action in these conflict fragile contexts is being tackled from a number of different angles, and there are a lot of opportunities to learn from each other. So again, this collaboration has been part of that learning. So Sampiria actually referenced something really important there, which is identifying beneficiaries or providing support to beneficiaries in different contexts and in fragile contexts. So the next question is exactly on that. How are beneficiaries selected when this operational context is so fragile, is so dynamic and changing? We know that the ERNE program has a well-structured targeting approach that starts at a sort of geographical targeting. There's a lot of coordination with other humanitarian actors. We've already referenced that in a number of the responses. And then from there, going down to community level targeting, which communities are most at risk and need to be prioritized based on needs assessments. And then even further down to the household level targeting. So there'd be pre-established selection criteria and community-based targeting approaches that can be quite complex. And I think we'll hear some of those challenges now. So these are the established kind of structure of targeting across the ERNE program. And yeah, we're going to ask Ibrahim actually initially to provide some responses from the context in Niger. Ibrahim's going to respond in French, which is very appropriate because not all countries are working in English. So we really welcome Ibrahim's input on this. Thank you, Ibrahim.
Bonjour à tous. Donc, par rapport au ciblage au Niger, ce qui s'est fait généralement, donc, suite à la campagne agricole, donc, on a un dispositif au niveau national. Donc, le dispositif national de prévention des crises et catastrophes et crises alimentaires. Donc, à l'issue de sous ce dispositif, nous avons 3 cellules. La cellule SAP, cellule du système d'alerte précoce, la cellule crise alimentaire et la cellule filets sociaux qui s'occupe de tout ce qui est activité de résilience. Donc, suite à la fin de la campagne, on fait une évaluation de la campagne et il y a le SAP qui se réunit 2 fois dans l'année. Il se réunit dans une première fois en novembre, juste après la fin de la campagne, en novembre, pour faire une évaluation. Suite à évaluer, voir quelle est la production du pays. Et suite à ça, voir quels sont les villages, quelles sont les zones déficitaires. Donc, à l'issue de ça, on a la cartographie de toutes les zones déficitaires du Niger. Et nous, au niveau de ERNE, au niveau du programme ERNE, on cible les phases et les départements qui sont en crise, donc la phase 3. Donc, c'est tous les départements phasés en phase 3. Donc, notre intervention va se dérouler dans ces zones en phase 3. Donc, qu'est-ce qu'on fait? On fait d'abord une analyse, on fait une enquête et une étude de marché et accompagnée du ciblage. Donc, suite à ça, on cible les ménages les plus vulnérables à travers la catégorisation. Généralement, nous, le programme ERNE cible les ménages qui sont dans la catégorie D, parce qu'on suppose que c'est les ménages les plus vulnérables. Donc, suite à ce ciblage, et on a le nombre de bénéficiaires, et là, on passe aux réponses. À l'assistance alimentaire à ces ménages qui sont les plus vulnérables. Donc, grosso modo, voici comment est-ce que nous faisons le ciblage. Donc, vraiment, il y a une coordination et de la base jusqu'au sommet. Donc, au niveau de la base, on a tout ce qui a comme les structures communautaires, les SCAPRU, qui font remonter des données. C'est des structures qui ont été mises en place par le structure globale.
Merci, Ibrahim. Thank you very much. A very comprehensive response. And again, I encourage those who are interested to look at the Niger case study that we referenced earlier. Isatu has some interesting insights. South Sudan, very dominated by flooding. Isatu, I wonder if you could provide some insights. Thanks.
Okay, thank you. Targeting is one of the difficult and complicated process in any response. So by chance, or there is a possibility that someone can include non-eligible households, or there is a possibility to exclude the eligible ones. So to identify this kind of eligible beneficiary and to avoid those risks, it has not been easy for us to go through the process. So at the very beginning of from the point of entry, we clarified the targeting criteria at community level. That started at government level, then at community level with the targeting committee, clear targeting criteria. Those criteria were clarified to the community leaders and members of the affected, representatives of the affected population, as well as grassroots level government representative. So that targeting committee was led by a team leader from Concern Worldwide, so that all the anomalies, the expected anomalies would be tackled. And there were around 7 different criteria, which mainly focus on households with older men and women, and with the children of a significant number of children under 5 years of age, families with orphan, and poor families hit by critically ill person. These were some of the criteria we applied. The criteria by itself didn't have the confidence, so we had to hire additional enumerators, and we equipped them with how to capture those information based on the set template and the criteria. So the targeting process went on door to door and cross-checking against whether that household is meeting the mentioned criteria or not. And based on that, all the information we gathered that was verified and validated at a central point for that specific village and the location. And after the verification process, the payments and the cash transfer process took place. So the targeting process by itself, just from the process, we learned that we received very limited to none complaints during the transfer as well as during the verification process. So from that, we learned that the process we underwent was somewhat better than sometimes there was some culture of providing a quota system kind of thing. So a given partner can provide like 100 households to a given location. Then that had given the leaders of the community to bring the names of those individuals who are more affiliated to those leadership, those people who are holding the leadership position or the community leaders. So the way we tried to implement really avoid, because by the end of the transfer, even after the transfer during the PDM post-distribution monitoring period, we didn't find critical complaints about exclusion and inclusion error. So when we come to early warning, early action response, we just became very conservative in narrowing down the criteria to very specific numbers and tried to pre-target those households who will likely to face vulnerability at different aspects for the anticipated disaster for some period of time. So based on that, the same procedure we went on, and finally we managed to address the most needy and vulnerable people based on that vulnerability and refining the targeting process by itself. Thank you.
Thanks so much, Isatu. It's really impressive the level of effort and thought that's gone into the targeting process across the ERNE program. I think there's a lot to learn from that. So moving on, once the action has been implemented, the next sort of key task is to monitor the outcomes and the impact. And the ERNE program has a rigorous process for doing this through post-distribution monitoring using the food consumption scores and coping strategy index. So this is a well practiced system, but it would be really good. Oh, Haman, I see your hand there. Haman, do you want to try and come in?
Yes. Yeah, to measure the out. Can you hear me now?
Yes. Yeah.
Okay, the measurement of the outcome of our intervention during both in-kind distribution or cash distribution, we are using the two indicators in overall, the food consumption score and the reduced coping strategy index. So yeah, this measurement is done by our meal team before each intervention and after the distribution. We are organizing the monitoring through data collection at the households level. And this collection are organized generally 2 to 3 weeks after each distribution. And yeah, and we are measuring the impact of our intervention by evaluation of the food consumption score. Yeah, thank you.
Great, thanks so much. It's great that we can hear you now and get your expertise and insights. Thank you. Alamayehu, I wonder if you wanted to provide some more insights on this question.
Okay, thank you. So we also use PDM to constantly measure the outcome of these indicators, specifically food consumption score and reduced coping strategies. On top of this standard indicator, we have also a number of questions within this PDM, like who in the household use this income, how the decision has been made, and the cash being provided to the relevant persons, or whether the households have meet their basic needs and like of all these questions have been indicated in the PDM. So the results of this PDM has told us that about 95% of the recipient or the target population have able to or managed to meet their basic food requirements. So particularly in the Somali region, where we have experienced about 5 seasons rainfall. So the PDM helped us to understand that the needs that we have responded with, like by providing 3 rounds of small amount of cash, has not been enough to meet the basic needs of this household. So because of these results, what we did was we didn't stop at that point. What we did was we scaled up our response from 3 rounds to 6 rounds, so as to fulfill or support these households to meet their basic needs. So these are the things that we've managed in our context. Thanks.
Great, thanks, Salome. I think that example of scaling up based on the post-distribution monitoring is really interesting, and it's a really flexible approach. Lastly, on this question, I just wanted to call on Isatu, who had some interesting insights on some of the gender aspects of the post-distribution monitoring. Isatu.
Okay.
Thanks.
Yeah, in South Sudan, just this the post distribution monitoring tool that we have been using as universal within the system concern worldwide, and it has been picking a number of impact-related indicators. One of the indicators that is measuring was the performance of the transfer itself, and which has been considering the security aspect and the safety aspect, as well as the distance, the travel, whether the beneficiaries are going back during the same daylight or not. These are and the waiting time. These are some of the performance indicator measure one that we applied to measure the whole performance. So during this period, it has been identified that performance increased significantly up to 90% because of from the lessons learned from the monitoring of the process. We managed to improve some of the findings and tried to transfer cash more closer to the vicinity of the households so that the performance was improved. And in addition to that, there is also very clear performance indicator measuring the participation of decision-making power at household level. In South Sudan, it is a male-dominated community where the husband has 100% power to decide whatever he likes. So during the cash transfer, during the first period, we identified that the participation of women at household level, it was around 30%. That means joint decision-making power was at that level. After the second round, we just tried to pass the message, the importance of sharing and making decision appropriately and jointly, so that they should be able to cover their basic needs based on that need and decision coming from different parts, husband and the wife. So those awareness creation points were part of the pre-transfer message that we did during the transfer. So after that transfer, the PDM uncovered a significant improvement on the percentage of households who decided jointly at household level, which increased from 30% to 47%. So an increment of 17% within that period of 2 to 3 months was really the impact of the transfer. So given the delicate nature of the cash transfer and its sensitiveness, we didn't anticipate that kind of change could be observed within the households. So yeah, the process by itself laid good ground, not only for this program itself, but also for some other programming in the future for concern, as well as for some other humanitarian actors to go into and streamline the activities and the implementation based on that practical aspect that can bring a real impact within the household, especially gender dynamics. Thank you.
Thanks so much, Isatu. I've certainly found that really interesting and really encouraging to see the different kind of impacts that these programs can have. So building on that, I'm going to pass over again to Simpiwe to ask the question of what can we learn from some of these ERNE experiences around monitoring impact of forecast-based financing or anticipatory action, and how might this compare with some other experiences in this area? Simpiwe?
Thanks, Chris. Can you hear me?
Yep, perfect.
Wonderful. Yeah, so there's, again, thank you to the colleagues on the ground. I think lots of really important sort of lessons learned coming out in terms of monitoring impact. So we know that there's certainly hard evidence that acting in anticipation of a disaster instead of solely in response to a disaster and, you know, delivering support to the most vulnerable through whether it's social protection or government social assistance in some contexts can reduce the impacts of extreme weather events. So in this context, we're talking maybe about drought, flooding or other climate and extreme weather events. But in order to target the right people at the right time and reduce the impacts and costs of response and recovery, we need to be able to monitor and evaluate impact and then scale it up and project into the future how to deliver efficient programs. So these concepts, I think there are certainly examples in the Climate Center's work with other partners. Again, I'll mention partners in the broader humanitarian space. And much of the work relies on strong and effective forecast-based action and what's called shock responsive social protection. So those two concepts present, I think, the best opportunity in many cases to identify, understand, and address monitoring and evaluation along the lines of improving system delivery, building off of innovations, reducing the disaster burden in disaster-prone countries. But there are, you know, obviously challenges like some of those that have been mentioned in terms of data, access, logistics. Ultimately, there are very few countries where anticipatory action has been successfully integrated into more institutionalized social protection systems. So often there are issues related to how the existing social protection or social security allowance in a country works, how it's been institutionalized. Sorry, how it's institutionalized, how it's been designed, what the testing and the advocacy framework is like. And those types of challenges, I think, dictate how and whether it is possible to integrate shock responsive anticipatory action, and especially shock responsive anticipatory action that falls under a social security allowance program or social protection program. So in that sense, I think another sort of worthwhile example, another worthwhile case study is if we look at COVID-19, right? So experiences of the COVID-19 preparedness and response operations across countries, not just fragile and conflict affected countries, but even in the best of contexts, you can see through COVID-19 how what we consider in this context to be early warning, shock responsive, early action can be associated with or challenged by existing systems related to social protection, fragility, governance, socioeconomic challenges. And I think COVID-19 actually shows in in a related but perhaps more dynamic and global way why you need effective monitoring and evaluation frameworks, and especially those that rely in this context on, you know, climate smart contingency planning, institutionalization, so that anticipatory action is shock responsive and can be scaled up. I hope that answers your question, Chris. Thanks very much.
Super, thanks, Simply. We're, yeah, once again, broadening up the landscape, broadening up the picture, which I think is really valuable. So thanks very much. Great. So we've essentially gone through our program, but we want to end on a inspiring note to leave us all feeling encouraged and enthusiastic about pushing these ideas forward. So for this last session, we just kind of go around the room and ask people to provide a little bit of inspiration. So what has inspired you as you've worked with the Concern ERNE program in partnership with the Red Cross Climate Center over the past years? And we'll go around the room, and if I could just ask people to put their cameras on, if that's possible, while they're providing their input. It's really nice to see faces and to engage with people. So I'm going to, in fact, if you can all put cameras on, that would be even more beautiful. So let's start with Haman. We know we've struggled to hear you at points today, so it's appropriate that we start with you, and it'd be great to hear your insights on what's inspired you. Thanks, Haman.
Okay, thank you, Chris. Yeah, for my side, in terms of inspiration after implementing the early warning, early action component, yeah, my understanding is all these challenges are not expected, because we have the norm in terms of timeline of implementation of the activity, and at the same time we have unexpected challenges. But the most important, at the end, we see all our intervention have an impact in the community that we support. Without this support that we provide to this community, the population will be more in difficulty. So at the all, what I see after all implementation of this activity, the impact was very visible, and yeah, people are happy with intervention of consent. So the inspiration at the end for me is to open discussion to review maybe the norm in terms of timeline, in terms of rules, how to implement again the early warning, early action, and try to adapt it in the difficult context that we are working, without generating global recommendation, but trying to adapt and evaluate each area in its own reality. So yeah, it's my final word, and thank you very much, and sorry for all internet issues. Yeah,
not at all. Thank you for persisting. That seems to be the theme of Concern ERNE, is persisting through times of trial. So, and thank you for the inspiration. It's so great to hear that the impact is happening and people are being reached. Tommy, I wonder if I could hand over to you.
Yeah, okay, yeah, thanks. I will not repeat on the positive outcomes that we have seen in the lives of people that we have supported. Yeah, but maybe I would take on the other angle, like you're looking the way how any about the early warning, early action part has contributed to the Sudan country program. It's like it has changed a lot in terms of the capacity of staff, the way how things should be done, and then even like some of the successes from ERNE, like for example the tools, they are even being used in other projects in Sudan, which is something that is very positive. Even as the ones who are working for ERNE, we have also developed our capacity. Like I'm speaking from Malawi, where I'm attending the African regional symposium on the loss and damage, where like a lot of issues of focus-based financing, early warning actions have also been emphasized. So for me personally, I would really wish that this should not be the end, but it should be the beginning of maybe you're bringing in your more integrated programs to also find the best way how we can integrate issues of early warning action in I think it has been a wonderful opportunity for capacity development. Yeah, we have learned a lot, and we know that the Concern Worldwide is going to bid on this and to develop more projects where we can be coordinating with your partners like the Red Cross, who for me, I think they have also played a very big role in ensuring that we also have the required capacity in as far as the issues of early warning area action is concerned. Over.
Thank you so much, Tommy. That's really encouraging. Really good feedback. Isatu, can I hand over to you?
Yeah, thank you. This program is for 3 years. It started in 2020, 2021. And during the first year of the program, we didn't do any cash transfer because it was not planned as well. And starting from year 2, we had that plan, and we had some anticipated emergencies. And there was no experience on the ground, even no system. And we were the first to initiate this cash transfer in that difficult location. So everything was just, everything was full of confusion for us, how to go and how to start. Yeah, all those situations were very, very disaster for us, for the system, even on the ground. So to move forward for targeting and all to undertake all the processes and even to engage the financial service providers and reaching community members who have been in islands located in different locations, it was very difficult time. But with the support and the commitment and the engagement from different sides in the internal system, as well as some information from the partner, we just had got into that commitment to proceed with the cash transfer process. And we caused the establishment of cash working technical group at the state level. And we were a pioneer for that. So that is very inspiring. Now it has grown, and currently a number of humanitarian actors, including some UN agencies, have been using and transferring cash. And so that inspired me a lot. And this process also has given us a big opportunity to link with different people from across these 4 or 5 countries, how the early warning, early system is being established, and some peculiar kind of a difficult situation, and how each and every one has been adapting to move forward within a specific time frame. And the relationship even that we had with the Red Cross Climate Center, that was also very interesting. And we wished if it had come earlier than this time, we would have done something different from the situation where we are now. So that also inspired us, even personally. It inspired me to browse, to Google more about anticipatory action and the climatological related things, and to read out more about the Red Cross Climate Center activities and the implementation. So there are a number of lessons, theoretical as well as with a commitment to translate those into practical, and that can fit into our specific contextual situation. So we have seen and we have grasped a number of such opportunities and to dig into and get that information, which helped us even for future planning, how to go about early warning, early action system establishment, anticipatory action. And it helped me to pick some areas of points of advocacy for a number of items, how to reach and the donor community, how to advocate the anticipatory action and its outcome before something happens and creates some disastrous situation in the lives of community members. So these are some of the few points that I wanted to mention as very inspirational in our location, and where we managed to address more than 33,000 individuals in that difficult context. Thank you.
I'm going to actually ask Gashane if you would like to provide some last thoughts.
Yeah, thanks, Chris. I'm really inspired by the experience that we have shared across different countries. You know, there is an experience sharing between Ethiopia and Niger team. We have got quite a lot of experiences from this experience, this exchange learning. And the other thing, despite the early warning, early action activities at the earliest stage in our country, we have gone quite an inspiring stage to establish the system at zonal level in the country. The system is very new for the government, and so our team at the ground level have got quite a lot of works to let the government know the system and to incorporate in the system into the early warning system. And on the rapid response as well, we have made quite a lot of, we have reached a lot of beneficiaries, and this is one thing that have inspired me. Thanks. Over.
Great. Thanks so much. More inspiration. And I think lastly, but not leastly, Alamayehu, I wonder if you could provide some thoughts.
Yeah, thanks. So the multi-country platform that has been created for sharing of experiences and lessons, challenges, how this anticipatory action is implemented across the country. So this is one of the major things that inspired me. So and this connection, the capacity building effort that has been offered by Red Cross Climate Center, this through online, and the follow-up of this, the activities, as well as challenges and like, are one of the major things that have inspired me. Thanks.
Thanks so much, Alamayehu. So it's been a great round of reflections, some last insights and some inspiration to encourage us. And for some final comments, can I hand over to Jacqueline?
Thank you, Chris, for leading us through what can only be called an engaging conversation. You've given us time to reflect on, we're usually so busy implementing that you've really helped us take stock of what we're doing and make some good reflections on the design and implementation of early warning, early action. And thank you also to the team who's come online from their different locations and sharing the truth of our experiences. Some things work better than others. From my side, following up from me at Dublin level and following the evolution of our work, for me, the most inspiring thing about the collaboration with the Climate Center and Concern over the implementation has been that I've realized we're actually asking the same questions, you know, at both spectrums, you know, whether we're climate scientists or whether we're feet on the ground NGO workers. We just want to know, what is the best early warning system that can actually trigger a timely action? How can we galvanize humanitarian efforts in a timely way? And this does require joining forces with actors like you, who got a much more global bird's eye view of the science behind it, us with feet on the ground, and then a whole range of intermediaries. So I think this partnership, that this journey that we've been on over the last few years is hopefully the beginning of something that can carry on, because we're still learning as we're doing. So a very fruitful partnership indeed.
Thanks so much, Jacqueline. And I'm not going to add much more to that, except one last thought, which is one of the reasons I chose to shift partly out of academia and working with the Climate Center and the Red Cross is exactly that I didn't want to just produce science for science sake. I didn't want to just produce data for data's sake. I wanted to know that what we were doing was having a real impact on the ground. So for me, it's been so encouraging and inspiring and so challenging as well to learn how difficult it is to bring it to the ground. But what amazing impacts it can be when we manage to do that and make those connections. So thank you to everybody. Thank you to Jacqueline for shepherding us through this process as well. And a real thank you to all the country team members for sticking with the process, for joining training calls even when it's so difficult, for asking really good questions, and for trying so hard to bring this stuff to the ground and bringing around amazing successes. So thank you, a huge thank you to everybody. And thank you for your time today. And I hope those who watch this online benefit from it as much as we do. Goodbye.
Thank you.
Thank you. Bye-bye.
Okay, thank you. Bye.